Welcome to MDNews.com. This is Charlie Milburn. We're coming to you from location at the Society for Healthcare Strategy and Market Development 2010 Annual Conference in Chicago. We spoke with some of the leading healthcare marketing minds on a number of topics, from physicians and social media, physician relations, to a number of things. Take a look at what they had to say.
Well, employing physicians has become a new trend, obviously, nationwide. Specifically to us, we're a 167-bed facility. It's very important for us to maintain our relationships with our physicians. As you know, they're our main base of referrals. That's where we get our patients. And we've actually employed several recently. And so every time we employ a physician, we have certain expectations that are set as far as I take them around. I'm the marketing director. I take them around to other physicians, primary cares, introduce them to the community, and allow them to have FaceTime with the physicians who they're going to be working with, and just get to know them. In addition to that, we do some marketing in newspapers. We do educational seminars trying to bring the community in to meet these new physicians. We'll do an open house at their clinic. We do a lot of web-based things, and there's a variety. There's actually a list of things that we do for every new physician coming in. So we know that we're doing the same things for everyone, trying to stay consistent. And we try to really help them get to know the community. We're a smaller community, so it's very important for them to get out and meet different community groups, such as the chambers of commerce and things like that. We'll have them go speak, introduce them. So there's a variety of ways that we help them become involved.
So the first thing that we like to do is to get to know the physician and understand what they do, what kind of medical specialty they have, their clinical interests, what research they might be doing. And then we talk to them a little bit about the process for getting patients in, how that's going to work. In some cases, that may already been set up. In some cases, it may be a new process. And we try to manage their expectations by making sure they understand that we're not necessarily going to go out and advertise in local media, but we're going to try to build relationships with referring physicians. So we want to understand the kind of patients that they're looking for and the kind of physicians that would be referring to them. And then we look to set up kinds of programs that would help foster those kinds of referrals, such as physician dinners, meet and greets. We might also, if it's a particular specialty that's patient-oriented, we might be able to help set up patient seminars and help to get media outreach about the kinds of things that they do so that consumers would know about them. And of course, web-based kinds of initiatives as well.
Today I'd like to talk a little bit about how consumers are wanting to know more about their doctors on a more personal level. And some hospitals, I understand, are starting to market a little bit more towards this trend. For instance, on their websites, they're telling consumers who come there not only why they should come to a specific hospital for a specific treatment, but a little bit about why the doctors there matter and why those doctors can deliver something to the local community and the patient that maybe they can't get even if they travel 100 miles or 1,000 miles. So this touch relating to the consumer, working with them, engaging them is becoming more and more important. And I think one can do that not only with websites, but with videos, and certainly with social media becoming an even more, major player in the media mix of healthcare these days.
So now that you've heard what they have to say, we want to know what you think. Click on the Share Your Perspectives link on MDNews.com and give us your opinion. Reporting from SHSMD in Chicago, this is Charlie Milburn for MDNews.com.